Okay, I think we're ready to begin with vitamins now. Vitamins are organic compounds. They are essential to life and health. Vitamins help regulate body processes, and they're needed in very small amounts. They have no fuel value, so there's no milligrams per kilogram attached to them, but they are required for the metabolism of fats, carbohydrates, and proteins. Because there are many different vitamins, the recommended daily allowances for each is different. They are given by weight in milligrams or micrograms, though. And functions of vitamins are unique to the individual vitamin. On page 371 in the book, table 18-3 tell you about lifestyle choices and the supplements that may be needed for those lifestyle choices, because vitamins that are taken in addition to what's taken in with the diet are called vitamin supplements. And based on the lifestyle choices that some people make, they need additional vitamins in their diet. So as you can see from that table, restricted diets need extra B12, and alcoholics need extra thiamine and folate, and smokers need extra vitamin C. So for you smokers out there, if you didn't know that, make a note to get yourself some vitamin C. If you have excessive caffeine in your diet, you may need B vitamins or vitamin C as well. So all you monster drinkers and things like that, take that into account as well. What's interesting for alcoholics is that if you ever work in an acute care setting, like the hospital or in an ER or something like that, you may see patients that have banana bags, is what they'll be referred to. Excuse me. And they are simply bags of IV fluids that have all of these additional vitamins and minerals and things in them that alcoholics lack because of the diet or because of the effects that the alcohol has on their system. So if you ever hear the term banana bag, it's most likely for a patient that is an alcoholic. So just keep that in mind. Okay, vitamins are classified according to solubility. So A, D, E, and K are fat soluble. All dogs eat kibble. A, D, E, K. Those are fat soluble vitamins, and then B's and C's are water soluble. The fat soluble vitamins require the presence of fats for absorption to take place in the GI tract. They also must attach to protein carriers to be transported through the blood. The body stores these, and their daily reserves makes it unnecessary for daily intake to take place. So remember that. Fat soluble vitamins A, D, E, K. All dogs eat kibble. They are not required to be taken in the diet daily because they are stored in the body. The reserve in the body can reach toxic levels if large supplemental doses are taken, especially in the case of vitamin A. So if a patient has some kind of disease process going on where fat absorption is interfered with, you can have deficiencies of these fat soluble vitamins. The next ones are water soluble vitamins, which are the C and the B complex vitamins. They require daily ingestion in normal quantities because they are not stored in the body. They are absorbed by the capillaries into the intestinal villi directly into the circulatory system. People can develop quickly deficiencies in these vitamins if they don't have adequate intake. So to get the adequate intake of vitamin C, some of the recommendations are that food should be cooked in the least amount of water possible, because the water-soluble vitamins are released into the cooking water, and then the water is discarded, and you're left with the food, but the vitamins have been lost. So think about that when you cook the next time, and think about that with your patients who do their own cooking at home as opposed to eating out or anything else. That's a trick you can teach. So vitamins do not require digestion. Fat-soluble vitamins are absorbed into the lymphatic system, whereas water-soluble are absorbed directly into the circulatory system. So remember the difference in the two. Excess amounts of fat-soluble vitamins cannot be excreted, but are stored in the liver and adipose tissue. Water-soluble vitamins are excreted in the urine when they are in excess in the body. Vitamin deficiencies can occur, and they do result in disease. Persons that have a tendency to have vitamin deficiencies because they do not eat balanced diets include alcoholics, people in poverty situations, incapacitated elders, clients with serious diseases that affect appetite, the mentally retarded, and young children who do not get adequate care. Deficiencies of fat-soluble vitamins occur in clients with chronic malabsorption diseases such as cystic fibrosis, celiac disease, and Crohn's. And we're going to talk about the different types of vitamins and the... Okay, so on page 372 in your book, table 18-4, it begins the table about fat-soluble vitamins. Vitamin A, as you can see, aids in night vision, promotes growth of bones and teeth, and maintains skin and mucous membranes. Good sources of vitamin A are fish oils, carrots, sweet potatoes, broccoli, cantaloupe, and green leafy vegetables. Deficiencies in vitamin A can cause night blindness, dry, scaly skin, diarrhea, and respiratory infections. Never thought that, did you? And then toxic effects from supplementation are anorexia, diarrhea, hair loss, bone pain, and liver damage. So there are some serious side effects or toxic effects if you ingest too much vitamin A as a supplement. Vitamin D stimulates the absorption of calcium and phosphorus for good bone mineralization. Sources of vitamin D are yeast, fish oil livers, and fortified milk and cereals. Deficiencies can cause rickets, malformed teeth, and bone deformities. And then toxic effects are hypercalcemia, kidney stones, and cardiovascular damage. You will need to know all of the information for the fat-soluble vitamins on this table. Vitamin E is the next fat-soluble vitamin. It acts as an antioxidant. It maintains cell integrity and protects red blood cells from hemolysis. Good sources of vitamin E are vegetable oils, leafy vegetables, and wheat germ. Deficiencies in vitamin E cause increased red blood cell hemolysis and rare, except in the cases of fat malabsorption. Toxic effects of excess vitamin E are depression, fatigue, diarrhea, cramps, and headaches. Vitamin K. Vitamin K is responsible for the synthesis of prothrombin, which is necessary for blood clotting. Good sources of vitamin K are dark green leafy vegetables, and it's made in the intestines, intestinal bacteria. Deficiencies are rare except in newborns, and also there will be a delayed clotting effect. There are no toxic effects from an abundance of vitamin K in the system. But you do need to think about your patients who are on blood thinners, like your Coumadins and your warfarin, your heparin, Lovenox, things of that nature, about the relationship between vitamin K and people that are on those medications. Now, water-soluble vitamins. Vitamin C, which is ascorbic acid, has the function of builds and maintaining tissues, strong tissues, promotes wound healing, aids in resisting infection, and enhances iron absorption. So they have a medication called Vitron C, which is a combination of vitamin C and iron. So that's typically given to patients after they've had some kind of surgery, like a joint replacement or a joint repair, something like that. And it's because it's a combination. It gives them the vitamin C that's necessary, and it gives them the iron. Good sources of vitamin C are citrus fruits, green and red peppers, tomatoes, melons, cabbage, broccoli, and strawberries. If you have a deficiency of vitamin C, there can be scurvy, easy bruising, delayed wound healing, swollen inflamed gums, and secondary infections. Vitamin C can be toxic. With megadoses, you have excessive iron absorption, and there's nausea and diarrhea as well. For the water-soluble vitamins, I'm only going to pick out certain ones that you have to know. You will have to know, like I said, all of the fat-soluble vitamins, but water-solubles, I will pick out specific ones for you. Vitamin B1, which is thiamine, promotes carbohydrate metabolism and ensures normal nervous system functioning. Good sources of vitamin B1 are enriched grains and cereals, pork, and legumes. Deficiencies of vitamin B1 or thiamine can cause beriberi, mental confusion, anorexia, fatigue, and muscle weakness. There is no toxic effect for an excess of vitamin B1. Vitamin B2, which is riboflavin, promotes carbohydrate, protein, and fat metabolism, promotes DNA synthesis, and aids in protein synthesis. Good sources of vitamin B2 riboflavin are milk and milk products, meat, poultry, fish, enriched grains, and cereals. Deficiencies in riboflavin can cause oral lesions, dermatitis, chelosis, red swollen tongues, and reddening of the cornea. And again, there are no toxic effects of excess vitamin B2 riboflavin. The next water-soluble vitamin is niacin. You will need to know about niacin. It aids in oxidation, promotes carbohydrate, protein, and fat metabolism, and aids in tissue protein building. Good sources of niacin are meat, poultry, and fish, legumes, enriched grains, and peanuts. Deficiencies in niacin can cause pellagra, anorexia, apathy, weakness, dermatitis, diarrhea, and dementia. In large doses, niacin can cause flushing, itching, hypotension, and tachycardia. Niacin is also given many times for people with increased cholesterol levels because they don't want to take statins, or they have reactions to statins. They're allergic to statins, so they can't take them, so they take niacin instead. If you recommend to someone that they need to take niacin, or someone has recommended that they take niacin, they need to make sure that they purchase non-flushable niacin, or non-flushing niacin is what it should say on the bottle, because if not, after they take it, they're going to have this burning sensation that starts in the chest and just rushes up their face, and they're going to be completely flushed. They're just going to be red-faced, because that's one of the side effects of niacin. And if you take niacin for cholesterol, which it seems to work wonders for, you're going to get this flushing effect if you do not do not buy non-flushing niacin. So remember that niacin is also used for cholesterol, to bring it down, and it can cause flushing. Vitamin B6 is necessary for amino acid metabolisms, promotes blood formation, and maintains nervous tissue. Good sources of vitamin B6 are chicken, fish, and pork, eggs, and whole grains. Deficiencies in B6 can cause depression, dermatitis, abnormal brain waves, convulsions, and anemia. It can have toxic effects as well of clumsiness and nerve degeneration. Vitamin B12 is used to promote normal function of all cells, especially of the nervous system, promote blood formation, promote carbohydrate, protein, and fat metabolism, and it also aids in the synthesis of RNA and DNA, and it's necessary for folate metabolism. B12 sources are fresh shrimp, oysters, meats, milk, eggs, and cheese. Deficiencies of B12 can cause pernicious anemia, anorexia, indigestion, paresthesia of the hands and feet, poor coordination, and depression. There are no known toxic effects of excessive vitamin B12. B12 is another water-soluble vitamin that I want you to know everything about. Folate is the next water-soluble vitamin, folic acid. It's necessary for the synthesis of RNA and DNA, promotes amino acid metabolism, red blood cell and white blood cell formation, and prevents neural tube defects. That's why it's given to pregnant women, or women who think they want to become pregnant. Good sources of folate are green leafy vegetables, milk, eggs, yeast. Deficiencies can cause glossitis, diarrhea, and macrocytic anemia. There are no known toxic effects for folate.